What is a doctor's weirdest case of a patient accurately self-diagnosing? I was working the night shift in the ER when this college kid walks in at 2 a.m., holding a crumpled piece of paper. He looked like he hadn't slept in days, wearing a wrinkled hoodie and flip-flops. The triage nurse rolled her eyes because we get tons of students convinced they're dying from WebMD searches. The kid, maybe 19 or 20, sits down and immediately starts explaining his symptoms. But instead of the usual, "I think I have cancer" panic, he pulls out this handwritten list with detailed observations. He'd been tracking his symptoms for 3 weeks, like a science experiment. He tells me he's been getting these weird episodes where his vision goes blurry, his hands shake, and he feels like he's going to pass out. But here's the kicker, he figured out the exact pattern. It happened every Tuesday and Thursday at 11:15 a.m., and again on Fridays at 2:30 p.m. Most patients can barely remember when their symptoms started, but this guy had charts, actual charts with timestamps, what he ate, how much sleep he got, even the weather. I was impressed, but skeptical. Then he drops the bombshell, he thinks he has insulinoma, a rare pancreatic tumor that causes random blood sugar crashes. I nearly laughed because that's something most doctors go their entire careers without seeing. The odds of a college student correctly diagnosing this are basically zero. But his homework was so thorough that I decided to humor him. We ran the test during his next predicted episode time. Sure enough, his blood sugar tanked to dangerous levels right when he said it would. The weird part? He figured it out because his class schedule changed mid-semester. His symptoms always happened exactly 2 hours after eating at the dining hall. He started tracking which days he ate there and realized the pattern matched perfectly. Most people would just think they were stressed from school. This kid treated himself like a lab rat and cracked the code. The tumor was tiny, completely invisible on regular scans. We only found it because he told us exactly when to look. After surgery, he was completely fine. But the story doesn't end there. Word spread around the hospital about the student who outsmarted his doctors. Other medical students started bringing him their weird symptoms as a joke. The attending physician was so impressed that he offered the kid a research position. Turns out the guy wasn't even pre-med. He was studying computer science. He just applied the same logic he used for debugging code to his own body. 2 years later, he changed his major to medicine.